Hey, Rebels. Welcome back to Rebelcast, where we break down evidence, talk shop, and connect with the people shaping emergency medicine worldwide. Today's episode is a special one. We're highlighting the Incrementum Conference in Spain. As many of you know, emergency medicine was officially recognized as a specialty in Spain just last year after decades of advocacy. And Incrementum has quickly become a focal point for education, collaboration, and growth in the field. And I'm thrilled to be joined by the founders of Incrementum. Would you say that?
Yeah, we could
Dr.
say that.
Dr. Francisco Paco,
Yeah.
Campillo, Palma, and Dr. Carmen Maria Cano. Hopefully I said that right.
We have better Spanish that we have.
In English.
My wife has taught me well. These folks are the two driving forces behind the conference. So Paco and Carmen, thanks so much for joining us.
No, Marco, thank you so much for having us in this Rebellion. It's a dream for us to be here and joining Rebellion. I mean, we are like followers of you. We are super fans of Rebellion, so that's a pleasure, and we are thankful to be here.
Yeah, thank you
Yeah.
very much.
I appreciate it. Hopefully this is the first of many to come. So let's kick things off a bit. I want you to each share a bit about your background in emergency medicine and how you came to be involved in organizing Incrementum last year.
So let me tell you a story. Actually, that's happened in the last year in our training time. We decided to go abroad to Spain and fly to Costa Rica in order to see how was an emergency medicine system that has a structured education. And then we met our mentor, our friend, Manrico Maña. He was the one who showed us how amazing was FOMED and how disruptive education was outside of what we were used to learn from here in Spain. So we started to find out blogs and platforms like Rebellion, NRAP, Resources, Critical Care Now, some Tenlist, SGen, all of them. We were like really surprised. We have been missing out during all the year before because there was totally different about what we were learning from books and formal and traditional education here. So we were starting to travel around the conferences during the next year as assistant. We started to develop new skills, new ways of teaching and learning. And we brought all of this to Spain. And when we have to give a course, we were sharing all that type of education platform. So I remember to be writing in the board, all the names of the blogs of Rebel, of Mcrit, and all that type of stuff, because the people were full of interest to know where all this knowledge came from. And then was with Emergency Global System, the company behind Incrementum, knock our door and said to us, okay, you have been traveling during all this year to this conference and joining this type of education. Do you think that it's possible to bring that to Spain? And we weren't sure, but we said, okay, yes, try. And we were knocking the door of all the speakers that that we have it at the conferences. And we were really, really happy to see that all of them were in board really quickly. They were all ready to help. It has been amazing, all of them. I mean, actually, they are good professionals. They are good in skill and procedure, but they are even better people. And they were helping to us to create Incrementum. And that's was how Incrementum appears. Just with a good mentors who light on the flame and make us believe that two emergency medicine young doctors who just wanted to create something new and bring that to their country.
That really is an amazing story. And I'm glad that you had a mentor who was able to spark that and drive it, because things like this are really needed and just really important. So let's move on to the next question I have for you guys is, as we mentioned, emergency medicine was recognized as a specialty last year. So what did that milestone mean to both of you personally and for emergency medicine physicians in Spain?
Yeah, it was a historic moment. After decades of lots of EM docs fighting for this, seeing that it's a fact that is going to happen, it's a dream come true. I think after COVID, it was a real need to have, and it's already implemented. And for us, as a personal level, I think we have a mix of pride because we belong to this a committed community that we love, and also relief that is already happening, and hope because we are having better training, better options, and all of this can lead just to a better future for the specialty. So it's a good thing, and not just for the new residents, but for the doctors that we already work in that. It's a validation of the work that we always do. And for all the doctors in Spain who work in emergency department, it's like the validation of the thing that we knew, that emergency specialty is really important for the healthcare system and for the patients.
That's amazing. It really is. So let's move on a bit to the conference itself. And for the listeners who might not be that familiar, what exactly is Incrementum and how did it come about? I know Incrementum means growth in Latin. So why did you choose that name and how does it reflect the mission of the conference?
Yeah, we chose that name. We didn't want just a Spanish name, not just because of the pronunciation, but not mm, either an English name because we didn't make our people to feel that it's not for them. So we went to our roots, to our Latin words, and we found this. We found it a good word because it has the em inside, so it's perfect for that, and it reflects the meaning of growth, which is the thing that our specialty needs to do in Spain, and our networking with the Spanish emergency medicine with all the international system should grow as well. So that's why it's called like that.
And actually, Incrementum is also about networking, about create community. And I don't think that there is a better way to make the emergency medicine in a country that is, starting with that way, make it bigger and powerful that bring all the emergency physicians around the world to the same place and share their cases, their feeling, their experience. And I think that is the inspiration that the country that is developing their own path in their identity needs when they started. So we want to bring that type of vibe, that type of inspiration for our people and for the people outside that would be involved in incremental. So it's always trying to get bigger and bigger with the people that are the most important. The speaker and the audience is the most important, not the topic, not the other atmosphere, is people in audience, because that is what emergency medicine needs. People that love what they do.
Yeah, that's perfect. It's a perfect segue into the next question about the people, right? So Incrementum has attracted some of the biggest names in emergency medicine, certainly in FOMED. And last year's conference had star-studded, world-renowned experts in emergency medicine. So how did you manage to bring together this crazy lineup? And what was the experience like bringing all these folks together in Spain? And was there anything memorable that happened during the conference with everybody there?
Yeah. Actually, it was easier than that was expected because all the speakers really helped us to make what we made last year with Incrementum 2025. I mean, I can say it millions times, but when you have that type of professional people involved in something, you really think that they are like in another level of their life. But they were all humble. They were all ready to help. I remember just Mason Thursday saying, "No worries, Paco. Anything that happened during this stage, you took care of us. We will take care of you." I mean, that is a type of thing that just happen inside families, communities, friends. And I mean, that was pretty amazing to people that you follow during a lot of time, a lot of years, learning from them that actually you don't know in in a close way. We're ready to make your dream come true and be big, become bigger and bigger. And about the question about how was having all that type of top level speaker in emergency medicine, I will ask you the same question. With this, which are your favorite music band?
Oof, it depends on the era. My two favorite music bands are Guns N' Roses. I'm actually wearing
Okay.
the t-shirt right now.
Yeah.
Nirvana is a big
Okay.
one. Um, Speaking to that, Foo Fighters. Foo Fighters was left over after Kurt Cobain died. So those would probably be like three of my tops.
So let me ask you, wouldn't it be wonderful if you could go to a concert and listen and watch Nirvana, Foo Fighters, and Guns N' Roses at the
Nirvana.
same stage? I mean, how much would you pay for that? I mean,
Yeah, no
I mean,
kidding.
to me, watching George Willis, Wingard, Saline, Sarah, Jessica, all of the speakers that you have seen at the schedule is like going to a concert and watch AC/DC, Rolling Stone, Queen, all of them are
They're
at the
rock
same time.
stars.
I mean, that is what people love in music. That is what we love in emergency medicine. I mean, everybody that is involved in nowadays emergency medicine stuff knows that name, knows those names. And that is like the Rock in Rio of emergency medicine. I mean, to me, it's like going to Disneyland of emergency medicine. I love going there and sit down, and I know that all that they have to me is good for my patients. So that is how all this incremental, and that is how all these speakers were involved in this. We really want that what you have all around the world be at the same place in the same time and share it with our people that are emergency medicine. We love emergency medicine, and we wanted to create that type of Rock in Rio in emergency medicine.
Yeah, that's really great what you all are doing for the specialty in Spain. Looking ahead for this year, are there any sessions that you all want to highlight that the attendees should really look forward to?
As you can imagine, all of them, we have been working at the schedule and at the topics for 3 months until we get the actual schedule. But all of the talks will be amazing for sure. That will be cool. But if you ask me one specific, I'm truly interested about to listen Carmen Hidayati and Jessica Mason talking about bloody delivery, because we have building a really nice simulator that they will have on the stage. That would be really bloody. It's the only thing that I would say about that. And actually, there is another one that I really like. You love evidence-based medicine. One of these about C-collar. Campillo and Manrico Maña would talk about that. And even if you know the evidence, I really think that we will love what they have to say about this, I would say, torture instrument.
Yeah, it's interesting. I tell this to the residents all the time. There was this paper where they took healthy volunteers and they put an accelerometer on their head and neck, and they had healthy volunteers self-extricate from a fake crash with the accelerometer. And then they had the same volunteers be extricated by paramedics with a C-collar. And the patients who got extricated with the C-collar and paramedics had more head movement. I'm like, this is amazing. This is a great study.
Totally. I mean, I have listened Marika talking about that, but putting together with Camille, I mean,
it's going to be fun.
It will be. Speaker.
Knowledge. And this year we have focused more about mental health care, about how emergency medicine physicians take care about themselves. That is important for us because all of us has lost inside our work with colleagues. Everybody knows about burnout in our specialty. We wanted to focus and did sometimes during the conference for that. And also we were really focusing about to create some type of talks about dogmas in emergency medicine. So we want to destroy them with the evidence on Incrementum. So actually that would be the spoiler of this year.
Yeah, I really think that's great. If I think there's a single threat or the greatest threat to emergency medicine, it really is burnout. And, opinion, but I think we are probably the most heavily criticized specialty in medicine. And because we're at the intersection of every other specialty, right? Most of the care starts in the ER. So almost everybody could look back at what we did and what we didn't do. And I always try to have grace when we're reviewing cases, because it's a hard place to put yourself into, but you really have to, when you're judging care, you have to put yourself in the place of what did this person know at the moment that they made the decision, right? It's easy to look back and say, now that you know that this person has a STEMI or the trope is a million or whatever the case may be, I would have made this decision. I would have made that decision. But yeah, burnout is, in my opinion, the biggest risk to the specialty and to the individual in emergency medicine. It's a difficult job, and we work sometimes in difficult environments with limited resources, with not enough nursing, with not enough beds, lots of boarders, maybe not all the equipment and things like that. So it's really great that you guys are adding that to the lineup for this year.
Yes, and look, that is incremental, that is emergency medicine. We are not just interested about knowledge and about good stock and simulation. We are also interested about healing injuries and having fun time with the rest of the emergency physician all around the world. So, I mean, I think that sentence I listened from Mark, also from Rebel AM, and he said something like, when somebody tried to distinguish between good education and entertainment, they
They
don't
don't
know
know anything.
anything about
Yeah.
both of them. So I totally agree with that. There is a space inside Incrementum where people can be relaxed and also healing their injuries of the usual days.
Sure. Absolutely. Okay. So last question. Finally, for those who are listening and interested in attending Incrementum and they want to learn more, when and where is the conference? And where can they go to find out more information and register?
Yeah, it's going to happen again in 2026 in Murcia. So good gastronomy, seaside places, a lot of history. We are going to be there in 2026 April from 22nd to 24th. You can find all the information in incrementum-conference.com. And I've heard that you can actually die from FOMO, so don't risk your life. And please come join us because you'll have a great experience with us, and we can't wait to see you, all of you there.
Yeah, actually,
Yeah.
what the conference would say that they are working hard. I can promise you from the bottom of my heart that we are working really, really hard. We are giving all that we have in order to make an incredible experience. We are working really hard in order to make the people join these 3 amazing days. We are waiting all of you. Don't lose your chance because we promise to you that it will really worth it.
And I agree. I think FOMO is the one thing that we can't treat in the emergency department, right? It's terminal. If you come in with a case of FOMO, it's a wrap.
No.
I will add that we're going to have links to the Incrementum website in the show notes. And we're also going to be co-sponsored by Incrementum. So if you just check out the Rebel EM website, you'll find links to the Incrementum conference. So just make sure you click register and join us and some of the most amazing speakers in emergency medicine in 2026 in April.
Thank you very much.
Thank you. Thank you, Marco.
Yes. So Paco and Carmen, thank you both for joining us here. It's inspiring to see how far emergency medicine has come in Spain and what you're doing for emergency medicine. And I'm really excited to join Incrementum this year and see some of these top-notch speakers and just push the specialty forward on this international stage. And for our listeners, again, if you want to learn more, make sure you check out the links. Go to Incrementum, April 2022 through 2024 in Spain. How do you say that? Is Murcia?
Murcia.
Murcia.
Oh, right.
Make sure you check out the website. Make sure if you go, you say hello to Paco and Carmen, and you just thank them for driving emergency medicine forward. Thanks for tuning in. Be sure to follow us on social media. Subscribe to Rebelcast wherever you get your podcasts, and we'll catch up with you later.